If you've been told to use Jelonet, but you're not exactly sure what it does or how to apply it properly, this video will walk you through it step by step. Because using the wrong technique can actually slow healing, even if you're using the right dressing. Jelonet is a non-medicated paraffin gauze dressing. That means it's coated in a soft paraffin like petroleum jelly. It does not contain any antibiotics or active healing agents. Its main job is to protect the wound and keep it moist. It's designed to prevent dressings from sticking, reduce pain during removal, and protect delicate tissue while it heals. Jelonet is best used on superficial wounds, skin tears, minor burns, grazes or abrasions, and post-surgical wounds if advised by your doctor. It works well when the goal is to keep the wound moist and prevent trauma while removing dressings. Jelonet is not the right dressing choice if your wound has heavy drainage, is infected, covered in thick yellow slough, or is a very deep wound. Why? Because Jelonet does not absorb fluid. So if your wound is wet, this dressing can actually trap moisture and cause skin breakdown. So let's go over how to apply this dressing, but before you start, let's gather our supplies. Here's what you're going to need. A Jelonet dressing, a secondary absorbent dressing like a gauze or a foam, saline or wound cleanser, clean gloves, medical tape, or a bandage. Step 1. Clean the wound gently with saline or prescribed cleanser. Remove any loose debris, but don't scrub aggressively. Step 2. Dry the surrounding skin, making sure the skin around the wound is dry. This helps prevent breakdown and keeps your dressing secure. Step 3. Take the Jelonet, cut it to the size of your wound. You only want it about 1 finger width around the surrounding tissue onto the peri-wound tissue. So you just want to make sure that it lays directly over the wound surface. It's not bunched up in any way, and it's just laying flat about that 1 finger width around the peri-wound skin. So that's the good skin surrounding the wound. Step 4, add a secure dressing. This is a critical step because Jelonet does not absorb fluid, so you must put on a gauze or foam dressing on top to absorb any drainage. You're then going to secure this with tape, a wrap, a bandage to hold it all in place, making sure it's secure but not too tight to restrict blood flow. Now, you're probably wondering, how often do we change this dressing? Typically once a day or every other day. But if it becomes wet or soiled, make sure to change it out. If the dressing on removal is stuck, make sure you moisten it with some saline and it'll release in about 5 minutes. Now, let's go over some common mistakes to avoid while using this dressing. Don't use it on very wet wounds. Don't skip out on the secondary dressing. It's needed to absorb the exudate or fluid coming out of the wound. Don't let it overlap too far onto healthy skin. You just want it about that 1 finger width overlap. And don't leave it on for too long. These mistakes can lead to skin damage, delayed healing, and excess moisture buildup. This dressing is to be used for comfort when dressings are painful to remove. It's great for fragile skin on elderly patients, but make sure you're pairing it with the right secondary dressing based on the amount of drainage that's coming from the wound. Jelonet is a simple dressing to use, and if you're ever unsure if it's the right dressing for your wound, make sure to check with your nurse or healthcare provider. And if you want more straightforward wound care breakdowns like this, make sure to subscribe so you don't miss a single one. Head to thewoundconsultant.com for expert wound care consultations, practical guides, and educational books, your go-to resource for smarter wound healing.